We are live.
Hi, hello, and a very good evening. Welcome to iFocus Online, lecture number 508, Ophthalmology Clinics Exam Special. We have with us today Dr. Prafulla Maharana to deliver the lecture on postgraduate ophthalmology exam, how to optimize your score. He did his MD and senior residency in cornea, cataract, and refractive from RP Center, AIIMS, New Delhi, and holds the current position of additional professor at RP Center. He is the current secretary of Delhi Ophthalmological Society, editor of 3 Amazon bestsellers in ophthalmology, and editor of DOS Times and FOTI. He's the mentor for women scientists for DVT project. He has won the Best Surgical Technique Awards from Ransco, Australia, Young Achiever Award, ISCKRS, Ajit Babu Maji Award, and the awards for Best Papers in various conferences. He is the principal investigator in 2 ICMR trials and co-principal investigator in 18 trials, including 2 multicentric and international. He has published over 395 Google Scholar and 163 PubMed indexed papers with H index of more than 30, has authored over 50 chapters in national and international books. He has been listed among the top 0.08 percentage for cornea and 0.19 percentage for keratoconus scientists in the world. We welcome you, sir, again in this exam special, and over to you.
Thank you, Varnas, for that nice introduction. And okay, so I'll share my PPT. Thank you to Santosh Sonavar sir, if sir is joining today, for letting us do this special exam special series. You know, all these 3 books which Farnaz highlighted, the Amazon 3 bestsellers, these are nothing but these 3 books only. And the series that we conducted over last 1 month is a gist of that. Okay, so it was difficult for us to cover each and every aspect of that, but however, we just try to convey you that yes, these are the important points when you are referring to ophthalmic clinics, you should focus on. So today it's to once you have read your theory, once you have read your clinics, once you have read all the books, then the last or the judgment day is your theory and practical days. You know, and we all know, being in medical professional, any day can go wrong, right? Even if you have done your hard work for 3 years, but suddenly on exam day or day of your exam, something goes wrong and you start getting poor scores in the exam. So for that, I always believe you have to prepare yourself. If you are not well prepared, then you have to trust your luck on that particular day. Now, this is the classic schedule of any PG exam as recommended by NMC. And my PPT is full screen, right?
No, sir. Can you please put on your slideshow?
It's not going full screen, right?
No, it's not full screen.
Again, it's not going full screen. I don't know why. So I'll end the show and restart it again, right?
Yes,
Stop.
sir. Yes, sir.
So what I was telling you all students who have logged in here is that even if you have gone through your theory part, you have made notes. Okay. Sorry for that interruption. So, so how to optimize your score? So this is the classic pattern of exam in most of the postgraduate exams, especially at RP Center. And this is my exam schedule. So theory, we had 4 days, 4 papers. And first paper was about general ophthalmology, second medical, third surgical, and fourth is about systemic diseases and eye. Then comes your practical after a gap of 2-3 days. On day one, we had to give a thesis viva, and then there was 1 long case and 5 short case, and there was a refraction viva. Then again after day one, day two, there was a OT viva. Nowadays, of course, this has stopped. But when I appeared in my exam, we had to show phacoemulsification directly to the examiner. Nowadays, only video based. Then again another long case and short or spot, 8 spot cases. And then refraction viva. Day 1 used to be dry refraction, day 2 used to be wet refraction. And once this is done, on day 3 there will be grand viva, where all the examiner will be sitting together in a round table, and they will be asking you questions, and there will be your surgical instrument, there will be your eye drops, there will be your different maps like Offscan, FFA, Pentacam maps, and they will hand it over to you, and you'll have to interpret that. And then there used to be a appliances viva. Appliances viva means any instruments, like they will give a gorioscope or direct ophthalmoscope, or a slit lamp will be allotted to you, and you'll have 10 minutes to prepare. So what then the examiner will come to you and he will ask in detail about that appliance. What is the use? What are the principles? Draw the ray optics, and then the exam used to get over. So the thing is that theory, okay, you're well prepared, you can do that. Practical is the main challenge, because most of 99% of resident, they don't do any specific preparation for practical. But to tell you guys, most of the time the people who fails, right, it's not in the theory, it's basically in the practical. You fail in the practical, so that is often an ignored part. And once this third day is there, and I still remember my examiner was Dr. Amod Gupta from PGI, and he simply gave me a Goldman's field, and he asked you what is this, and I was completely blanked out, because this 2 days were so hectic. I was just holding the printout and sitting there for 2 minutes. Then he said, "Ki, Arey Prafulla, ye to Goldman's field hai." So that is the mindset, because you are never prepared specific for that particular part of your exam, like grand viva or how to interpret images. And again, the time is very short. Once you finish your day 1, you have hardly 3-4 hours to prepare. In that, you'll be preparing for long case, spot case, OT viva. So it's practically impossible. So it is on that particular day, after my day 3 was over, I was sitting, I still remember, I was sitting in front of my chief's office, and that day I decided that ki, no matter what it takes, I will write one book at least for practical, where the student will have something to go for at least one day before the exam. So all these ophthalmological clinics or postgraduate ophthalmology, these are books not from day 1 to day third year of your career. But if you have read your standard books, but you don't know how to approach for practical exams, then these books are going to be very useful for you, and that will allow you to optimize your score. So I will go one by one. This is just an example which I give to most of my PGs. If you are interested in cricket, this was a Sharjah match where Sachin Tendulkar single-handedly ensured that India wins that series. But if you see the list of batsmen like VBX Lakshman, Ganguly, है ना, they were also great batsmen. But on that particular day, one person outperformed all of them. So this is what all about your exam. No matter how much you have done your hard work, but on that particular day you have to perform. And you see, for that you have to prepare, है ना. Don't think that कि okay, मैंने कांस्की पूरा पढ़ लिया तो मैं सारे अच्छा स्कोर कर जाऊंगा. Okay, so for theory, two parts are important: how well you are prepared and how well you are presenting in the exam. Remember, the second part is in fact more important. Even if you know everything about keratoconus, but your presentation is poor in your theory paper, then you are not going to score well. So I'll give you few example. So for preparation for theory, what is important? Books, articles, notes, online information, previous year papers. These are all the things that is available for you to prepare. Now I'll go one by one, whether everything is important or not. So this is a 2010 MD ophthalmology exam. This is the exam which I appeared, right? So there was a question, because if you understand, then you can get what I am trying to tell you. The question was like, discuss, write a note on recent trends in dry eye, and that was a 20 marks question. Okay, so we used to get 5 20 marks question for theory. So one question was like recent trends in dry eye. Now remember, in none of the textbook you can get the answer of recent trends in dry eye or ARMD or diabetic retinopathy. Why? Because all the books, when you start writing a book and the book is published, there is a gap of at least 2 3 years. So the moment the book is published, so recent trends is gone. Whatever is there, that is already 2 3 years behind the current literature. So for attempting such questions and get good mark, you have to resort to the journals, articles, review articles. And for this question, this was my question, and there was an article of dysfunction tear syndrome. Nowadays we call it DUS, TFOS, but this is the first of his article published in Cornea in 2006, but it came out in print in 2008. So that was the paper that I had gone through. And if you go through this paper, you'll see not only they have established the factors, like then this is the classification, what is dysfunctional tear film classification, with lead margin disease, without lead margin disease. Then they have also provided a severity grading. Okay, so somehow I had made a note of all this thing in that recent trends. I mentioned all these things, and you remember that time Smolin and Krasmer used to be the two commonly used cornea books, and these things were never there, right? So the point I am highlighting is that if somebody would have gone through that article and he writes that at least these tables, treatment, all this thing, then that person will score better compared to the person who has simply gone through Smolin. So this is what gives you an extra edge. You remember all the doctors, they have an IQ of around 85. So the colleague with whom you are competing, he is also having the same IQ as you. But if your preparation is better than that, then you are going to score better. So that is what you should always remember. Now the question is, shall we read all the articles? Is it possible? Do we have that much time? So I'll tell you the story behind me going through this article. I attended a lecture. Okay, that was at RP Center lecture theater only, and somebody was presenting on same topic, dry eye latest trends or something topic was like that. But that person didn't mention this DUCE study, dysfunctional tear film study. Then one of my professor, and she kept on asking, what kind of PPT you are showing? You haven't mentioned anything about this DUCE panel, Delphi approach. Then that day I thought, okay, this Delphi approach of dysfunctional tear film may be some important thing. So I went back and go through the article. So that's it how I thought, but that is how I read this article. So the point that I am trying to make to you people is attend conferences, attend lectures. Nowadays, you people are getting everything in YouTube. So you are missing regular lectures or even conferences. But remember, if you attend conferences or lectures or webinars, at least you will get an idea what are the latest thing that is happening around and what you should be reading, and that should give you some extra score in your exam. So that is one point I wanted to make. So don't read all the articles, read review articles and read important articles. That will be told to you either by your teacher, or you can attend conferences, CMEs, webinars. There you will get an idea. So simply reading textbook is not going to give you good marks. You have to read other elements like articles also. Second important is notes. Okay, so I'll give an example. When we were MD student, that time Vitrus Emre used to come as a long essay type of question, and that time the best book was Ryan. Right, nowadays I think you have two or three options. Even if that is there, the chapter of Vitrus hemorrhages used to run 12 pages in Ryan. And then there was a review article in Survey of Ophthalmology that used to run for 28 pages. So now you remember, you imagine your exam is tomorrow and you want to revise vitreous hemorrhage. You cannot open Ryan or the Survey of Ophthalmology and go for 28 pages. Your entire time will be wasted in that only. So there comes the value of notes. Whenever there are any chapters or any sections which are very lengthy and it's difficult to revise uh, in a short time, that time you have to make notes. If you don't make notes, then it's very difficult for you to revise about that chapter. If I say vitreous hemorrhage, what are the important points? The important points are like, what are the causes, okay, with ischemia, without ischemia, what are the important clinical finding, how to approach vitreous hemorrhage. Those things, if you have already prepared a note, then it makes your life quite easy. And if you have revised just before the exam, if the question comes, then you are going to score better. Okay, then third aspect is online information. So in addition to standard textbook, one has to rely on that, because there are few questions, like nowadays AI in ophthalmology is a hot topic, right? So it's highly likely that either you get it as a short note, or in a long essay type, or even in your grind Viva also you can get some question. Now for AI in ophthalmology, it's difficult to get all the information in any standard textbook. So you have to rely on online information. If you go through the articles, it will be very difficult because it's an initial phase of AI use in ophthalmology. You'll get confused. So best part is use some online information. There are different websites like Review of Ophthalmology, CRST. In all there, what you get is you get a review, you get a concise review article about some latest topic. So you can make a note, you can take a printout, you can keep that with you, right? Similarly, community ophthalmology data. Okay, few seniors examiner, they are very fond of asking you what is cataract surgical rate, what is trachoma, all these things data. Okay, community ophthalmology, what is blindness, what is preventable blindness, and that even important for your SRC MCQ also. So for that, you have to rely on online data because whatever book or anything is available, that is already outdated by 4 or 5 years. Similarly, genetics in eye. COVID-19, of course, nowadays people are not that much interested, but one or few years back, this used to be a very hot topic, right? Similarly, for virus born like dengue manifestation, all this manifestation, that is very important for online resources. So what in last few of the slide, what I try to convince you that, see, books are must, right? You choose one particular textbook, Pease, American Acad, or some few textbooks, keep it as your baseline, but that is not going to help you. So on top of that, read articles, read online sources, and always make a habit of making notes. So and there are two ways, right? So what few people do, in the textbook itself, they keep on noting important points. Okay, the second approach is have a proper register and keep your all notes there, right? Now previous papers, so I'll tell you one of my example which we faced. So when we were preparing for our MD exam book, MD examination, we used to refer to all textbook. So me and my friend, we thought that okay, we have completed all the theory parts from the books. Now let's go for the revision. Okay, and somehow one of our friend, he had a he had a bundle of previous year question papers, and when we go through the question paper, then we were shocked because we were not prepared in the standard textbook. Whatever we had prepared, and the questions that were there, that were completely out of what to say, syllabus kind of questions. So it is very important to go through the previous papers. For example, current trend in management of wet AMD, right? That was a 2021 July AIIMS MD paper, that you can never write from any textbook, and that even you cannot read by simply, you cannot even imagine ki, okay, such question may come. Okay, so that's why it's very important to go through the previous paper. And since this was the problem, that's why I came out with this book, Postgraduate Ophthalmology and Exam Preparatory Manual. What we have done here is we have collected the last 5 years questions from the Delhi University, including RP Center, GNEC, everything. Then we rearrange those questions in chapter format. For example, let's say keratoconus. Okay, so we took all the questions from last 5 years about keratoconus. We put it that in one page, and then we arrange them as if somebody is going to read a theory paper. So, sorry, a standard textbook. For example, the first section was really dedicated to questions that were related to keratoconus epidemiology, signs, symptoms, diagnosis. The second section, all the questions related to investigation were clubbed. Third, all the questions related to management were there. So the sequence of questions were that, like as if you are reading a textbook and heading wise, right? And then we answered specifically to this question. Okay, so that you are not digress. For example, suppose keratoconus is a chapter. If you open it in Krasmer, then you will first read epidemiology, then you will read the signs, symptoms. Okay, but suddenly you will get a question. Suppose what are the late signs of keratoconus? So write a short note. Then you are completely clueless because you have read all the signs, but you don't know what are the late signs, right? Similarly, suppose a question comes like, okay, in a case of keratoconus, if your corneal thickness is less than 400, what are the treatment options? That you will never prepare when you are reading a textbook. Textbook will give you heading CXL, cornea transplant, scleral contact lens, but the question is specifically to one particular stage. So for that, you have to prepare prior. And how to prepare? You must know the previous questions. Then only you can prepare. So this book was all about previous questions and answer. So it's like a question, answer in any particular chapter in a sequence, right? So you can follow that book. That is only question answer pattern book. So this is what all about preparation, right? So read any standard textbook. Then on top of that, read articles, journals, review articles, online information, and then make note and keep it in one place, and then go through all the previous year papers so that you are mentally prepared. If question is twisted like this, what should I answer? Okay, so that is your theory preparation part. Once you are prepared, how to present. Now this is a very important part, and in a lot of people, they don't realize they score poor not because they have not written the right content, but they haven't presented the content. If I'll give you one example, suppose somebody asks you management of keratoconus, write a short note or a long question. So student one writes this, right? And he has covered everything: intracorneal rings, scleral contact lens, penetrating keratoplasty, everything is covered. Then student 2 presents it like this. First, the student 2 starts with a flow chart. Okay, keratoconus comes, check for contact lens use, spectacles, and to stabilize, go for toric, go for intracorneal ring segment. If nothing works, check the thickness. If more than 380, go for DALK. If less than 380, go for femto or manual DALK. If there is peripheral thinning, go for tuck-in lamellar keratoplasty. So if you start with this chart, trust me, examiners never bother to read what you have written in the text, because you must have noted, and even I have been examiner to multiple PG exams, they get hardly 2-3 minutes to check one student's answer sheets, right? And they don't have time to read line by line. Okay, they will just like this, and and if you have presented your data in the form of charts, tables, figures, well labeled figures, then they are not bothered of going into detail. But based on this only, if he sees this chart, the examiner know that this guy knows everything, right? So this is very important. This is a very important point. Similarly, another natural history of keratoconus, somebody writes a full paragraph: onset is at end of puberty, then rapid growth, then slow. Somebody instead of that just put a chart like this: around 14-15 onset, around 20 there is rapid progression, after 30 plateau, after 40 no progression. So definitely the person who is describing this in this chart format, he is going to score better compared to the person who is writing in a paragraph format. So nowadays, you all have tablets and iPads and your laptops. So it's a very good habit, when you are making note, rather than making explanatory essay type of note, use this tool in your microscope, in your Microsoft or Microsoft Word or Microsoft PowerPoint, and make charts, images, figures, and try to present your data in this pattern. Then that will give you better score. But too much of something is not good, right? So somebody, if some this is an article published in IGO about management of keratoconus. So this flow chart is perfectly fine, but the problem is you cannot replicate this in an exam. Even if you replicate this in exam, your examiner doesn't have so much time to go through all these bars and charts. So use flow charts, use diagrams, use tables, but don't complicate that too much that even the examiner feels ki kya likha hai. You will get negative score if you prepare such chart, right? So presentation, it has to be simple, it has to be easy to understand, and not too much time consuming, right? If there is a short note, for example, suppose there is a short note about techniques of DALK, right? If you write it in one page, you mention all the 4 techniques, advantage, disadvantage, then that is good enough. But the same question somebody can write in 10 pages also. He will describe the surgical steps, each and everything about all the described techniques: manual dial technique, bevel technique, okay, then your customized dial technique, tilt technique. Then the examiner will get bored. He will not read that much, right? So don't waste examiner's time while examining your paper. So write it in concise manner and in a manner which the examiner find it's very easy to read. Okay. So, and make a habit that if you think some points is very important, like some incidence, percentages, okay, so rate of perforation, always try to underline or use some different color pens, right? And when you are using different color pens, never use red and green, because red and greens are specific for examiners. Use black, use can blue different shades. Even you can use pink, but don't use red and green in your answer sheets. So this is all about theory. Okay, so you have gone through your textbooks, then you have 1 year left or 2 year left. Then follow this ophthalmology clinics, postgraduate ophthalmology clinics exam preparatory manual, and answer those questions question wise. Okay, or the best part is what I advise to my student: if you have gone through a chapter, say keratoconus, then open the keratoconus chapter in postgraduate ophthalmology exam preparatory manual. Read the questions. If you are happy, okay, I have answered all this, then move on to your next topic. So next will be covering the Viva. Next I'll be covering the practical part, right? Theory part is done. Now practical part. Now practical is a mixed bag, right? You get images, you get Viva questions, you get instruments. So for practical, you must have a book or note that address these specific things. Our ophthalmology clinics book both are meant for this only, to make your life easier, right? So long cases, short cases, you know your institute better than anyone, right? And you know the patient profile that is coming to you. So in whenever you are going for an exam, right, always make a list of such cases that is frequently seen in your OPD or at your center, because most of the time the cases will be given from OPD or indoor only. Okay, so make a list of common cases and that may be given to you, and prepare it before even your practical is there. At least start preparing 6 months to 1 year before the exam. Approach is different, you have to remember this, right? Why I'm emphasizing you need specific book or notes? Because textbook, if you have read through that, if you have gone through the textbook, you can never get good score in long cases, because the approach will be in a reverse manner. And history taking, right? Once you have done your MBBS, then you should remember the history taking basics. What is chief complaint? What is history of present illness? Because half of the time students get stuck in the history of present illness only. And there only your Viva goes on. And instead of the diagnosis that you have got as a case, the Viva goes to a different diagnosis. For example, I had a case of macular corneal dystrophy in my exam, and in history of present illness, there was history of recurrent watering because of recurrent epithelial erosion. So my entire Viva was on PACG, because PACG at that particular age could also present like intermittent redness, pain, and watering. So my entire Viva went in PACG. Macular dystrophy was not discussed at all. So give history taking importance. Think about common things. Don't answer rare things, right? If somebody asks you what is the common cause of endothelial decompensation, just say cataract surgery or fuchs or viral endothelitis. If you say some rare element like CMB endothelitis, then the exam will think इसको कुछ नहीं आता, कुछ भी याद करके answer कर रहा है. Okay. Even if your answer is right, but examiner is not going to give you good score. Differential diagnosis is important, as I highlighted, right? You must know the differential diagnosis of all the important long cases at least, because your Viva may go to a differential diagnosis rather than the diagnosis which is your long case. Be specific, है ना? Never give answer like ये पढ़ा था, ये भूल गई, सुबह पढ़ा था, कल पढ़ा था. Don't be like that. Just say कि sir, I'm not able to recollect. Okay. So be specific. Don't waste examiner's time. So I'm just giving you one example. Suppose you read a theory book, right? Corneal ulcer. So this is how it normally a chapter, textbook will present a corneal ulcer, right? Differential diagnosis, classical signs, and treatment option. So this chapter has everything, okay, for a corneal ulcer. But if you have read this chapter from textbook and you get a long case, trust me, you will find it very difficult to present a case in your exam, and the examiner will catch you at multiple points. Now, compared to that, this is a case from my book, Ophthalmology Clinics. This is corneal ulcer chapter. You see how we have approached this chapter. Rather than jumping into sign, symptom, everything, first there is a brief introduction. What is corneal ulcer? Then, if you see here, we are starting from chief complaint, how a corneal ulcer patient will present, because in exam their first heading will be chief complaint only. Then in history of present illness, I have highlighted what all things you need to ask. Is acanthamia, what would be there? Pain, based on pain, how you are going to have a differential diagnosis. Similarly, what are the different factors that you must enumerate in your exam? In your case, you have to ask about this history, because the examiner may ask you what are the predisposing factors you ask for, and you will be completely clueless. Then based on each signs like pain, sorry, each symptom, pain, discharge, these are the things you should ask, whether it is a sudden onset, rapid progression. If rapid progression, pseudomonas may be a cause, right? If slow, it may be a fungus. Decreased visual acuity, whether it was sudden or it is a smoldering cause. So all these things that in history you should ask, that is there in the chapter, right? Similarly, in past illness, what all you should ask. Okay. Similarly, when you come to examination, instead of writing it in front of science and everything, it's examination. In this headings only you are going to present. Say on examination, ocular examination, what are the visual acuity, and each aspect like eyelid, lid, lacrimal sac, conjunctiva. So it goes in a flow, right? It goes in a flow where how you are supposed to present to the examiner. Okay, it's not like the standard textbook like etiology, diagnosis, differential diagnosis. Okay, it goes the way you have to present, right? And we have included this differential diagnosis also, because half of the time the viva goes like this: acha, your patient had mucopurulent discharge, so what could be the cause? Okay, similarly then comes your corneal examination. This is important. So we have clearly mentioned, if corneal ulcer is there, you have to mention these headings: location, central, superior, and what are the differential diagnosis, size of the ulcer. All the headings that you must have recorded while taking history. The chapter are organized in that manner, right? And all the investigation, what all things should be done, and color coding, which is often very important for practical vivas, that is there. And a brief about specific clinical feature that will help you in your long case, right? Similarly, once that is done, what all investigation you will do, what is the grade of corneal ulcer? Remember somebody presenting, sir, this is a case of fungal corneal ulcer, and somebody saying, sir, this is grade 3 fungal corneal ulcer. So these two are completely different. The moment somebody say this is a grade 3, then the exam will be like, okay, this guy knows what is corneal ulcer grading. So your viva will be in a different, it will go in a different league at all, but completely. Okay. So for practical long cases, your approach has to be different. Either follow you this ophthalmology clinic series. This is just one case I am showing you, corneal ulcer. All the long cases are there in ophthalmology clinics. The headings are like long cases, short cases only. In long cases, we have covered the commonly used long cases given to students, and in short cases, we have included all the commonly given short cases. And wherever required, for example, Jones criteria of positive culture, this is a very favorite question among examiner. So we have given those questions little more importance, so that you people at least are well prepared, right? So this is how the chapter is organized. Then come to management. Here the examiner may ask you all these questions. So we have included. They may ask you when you give steroid, when you will give systemic, and all these things have been included. In the end, Viva questions. So once you present your case, the examiner may ask you few questions, right? Specific to your case. So all the questions, all the expertise that I have over the years teaching PGs, attending exam, being a student also, I have incorporated those questions. Okay, like what is the head's recommendation? Okay, what are the indication of therapeutic PKP, which the examiner often ask you. Okay, so we have included in the end of the chapter. So if you have already read the chapter from textbook, but your exam is near, or you are presenting like at RP center, our resident, they have to present the case. We have a round day, but they will present the case. So if you have that thing also, then you can keep this book bedside and take your history. Then that will ensure that even in exam, when you get the case, you have covered all the important point that should have been in the history, right? And this is what I was telling you. Answer to the point. Okay, if somebody asks you cause of bullous keratopathy, answer these three common causes. Don't go for chronic PSEG, PPCD, trauma, IL endothelial touch. These are rare causes of endothelial decompensation, but examiner may not like. Once you answer these three, the examiner may ask you, okay, tell me some rare causes. Then you can enumerate these causes. Okay. Okay, so this is what about long cases and short cases. Ophthalmology clinics 1 specifically deals with that only. Okay, we have sections like cornea, then long cases in cornea, then short cases in cornea. Sections retina, long cases, short cases. So that book is a must if you haven't prepared your own notes. Then comes your instrument. This is an essential part of all the practical exam. So practical point is, again, remember the instrument that is there in your OT. Those instrument will be there with the examiner. So it's always make a good habit when you're attending your OR or operation theater, operation room. Take picture of the instrument that is there. Typical instrument, common instrument like needle holder, forceps, that you can guess, limbs forceps, because you also use that. But rare instrument like collagen scoop, ABC resin scoop, take pictures and keep it with you. Make notes. If you don't have notes, you can follow my book, right? Again, textbook is not going to work. In none of the textbook you are going to get the instrument. Which book? Okay, there are several many, but we have this Ophthalmology Clinics book series. Okay, here you can see, as I have highlighted, we have covered basic science. Instruments are there. Investigations like pentagram imaging, OCT angio imaging are there, and interpretation of Viva voce, how to interpret images. So this is specifically meant for the practical part other than long cases and short cases, right? So So just to tell you one example, right? In that book, what I have done, the moment you read all the instrument together, there is a tendency to forget. So what we have done in this book, we have segregated the instrument chapter wise, like corneal instruments, oculoplasty instrument, so that it helps you in retaining better whatever you read. And as you can see here, we have covered different instrument in different sections, so that helps you in remembering better, right? So this is instrument. Okay, make note or follow standard textbooks. And remember, when examiner asks you about the instrument, don't fumble. First important job is to identify the instrument and spell it correctly. It often happens the examiner will ask you, tell me the spelling of decimal, tell me the spelling of your limbs, tell me the spelling of barakan. So be clear. Whenever there is an instrument, some name is there, be clear about the spelling of that particular instrument's name. Okay, then appliances. Appliances means, as I was telling you, in my exam, I was given Goldman lens, Goldman's 4 mirror lens, and all my Viva was on that only. The optics, uses. Okay, so similarly, uh, I have seen in many DNB exam also, you are being given some appliances, and the Viva will go on that. So always remember this. I hear uh, and I forget. I see, I remember. I do and I understand. So when you're doing your 3 year course in your institute, always make a habit of seeing things. If there is a biometer is there, then please go and try to do few cases on your own. In that way, you will never forget. Okay, if ultrasound is there, go to the ultrasound room and perform on your own. So that will help you in retaining the memory of that is appliances and how that is being used. And again, that textbook is not going to help you. There are several books in the market on this instrument and appliances. In ophthalmic clinics too, also we have covered all these appliances. Again, under headings, broad headings like oculoplasty, what are the different appliances, like exophthalmometer will be there, imaging techniques, then ultrasonography, all this. Similarly for cornea, slit lamp, keratometer, all these things. Okay, and we have tried our best to cover each and every point. For example, I would like to share this page of your direct ophthalmoscope. This is a very favorite Viva topic among your examiners. Okay, they will ask you about all these filters. They will ask you about when to use blue color, when to use green color. So we have me and my co-authors, really we have made a lot of effort so that it becomes simple to use. Small spot, what are the uses, slit, what are the uses, so that you don't waste time in searching in internet and here everything will be there in one table, so that will give you enough time to prepare, and don't waste time in searching all over here and there. These are the different appliances there are in the book. I think we have covered almost all the appliances, so you're not required to go anywhere. Just read that chapter of appliances, then you'll be good enough in appliances Viva. Then come to your images. Okay, so appliances may not be given in few of the exam, but images are an inevitable part. Nowadays they will give you some image and ask you what are those. So during the last 1 month course, I tried to ensure that at least corneal images and retinal images are covered. I hope Dr. Pranita and Dr. Ankur, they have, and Dr. Talvir also, Dr. Jyoti, all their classes will be useful to you about images on in their interpretation. Here I'll just highlight few points. Like we have a section called interpretation of images. Remember, whenever any image is given to you, never jump onto the diagnosis. For example, I'll just go through one example here, right? Suppose you have given a pentagram image like this, okay? Don't ever jump on to say that, sir, this is a keratoconus or this is a normal pentagram. Always start with like this, okay? This is a pentagram map showing four maps of refractive display, the left eye, age. All this parameter will be here of a 12-year-old patient. Then go through the parameter. The Kmax is this, the pachymetry apex is this, thinness pachy is this, and all the parameter. And then in the end say, ki, sir, based on all this finding, I think this is a case of keratoconus. Advanced, grade, moderate, mild. First is this is a case of keratoconus. So if you answer like that, then the examiner will give you full score. Similarly, Goldman's, don't jump into the diagnosis of this scotoma. Just say, ki, sir, this is a Goldman's visual field, right eye. If you can read the stimulus side, you can mention that also, like 3E0, VE0, 5E0. And then interpret the finding. The field shows a depressed response in the infranasal quadrant suggestive of inferior quadrantanopia. So first you go say this and then say, sir, my differential diagnosis will be maybe tumor, maybe infection, or maybe some infection of the occipital lobe. So that's how you present in the exam. Don't jump onto the diagnosis. First tell them your findings, then in the end you can say, based on this finding, this is maybe the case. And we have incorporated all the images in the revise. I have just revised this Ophthalmology Clinics too. So there we have included latest imaging like Octa, OCT, NGO, which is nowadays very favorite for retina examiners, wild field fundoscopy, Optos, all these things we have included in the revised edition. And we released it in the APAO 2 months back. So we can go through that. We have covered almost all the appliances in that book, in the revised book. Okay, so once appliances, instruments, everything is done, then what is Viva? Viva, although you have to appear Viva in all long case, short case, everywhere, but in few centers I have seen there is a specific grand Viva section. Okay, so always remember, you go through the commonly used drops. They have a few centers, they have a very they have a tendency to keep those timolol drops, brimonidine drops, tropicamide drops. Okay, so antibiotic, cycloplegic, and all specific anti-glaucoma medications. Please have a basic idea and go through the basic principle, how they work, in which cases they are used, right? So in Grand Viva, that will be there, images will be there, instruments will be there, and appliances will be there. So you please be prepare about the drops also, okay? So don't answer rare things, you know, as I said, prepare a list. You know the internals, because you know, okay, so most of the time, because for example, suppose I'll be the examiner, my students know that my primary field is cornea, cataract, refractive. So whenever I ask some question which are little difficult, then that will be from my field only, right? I cannot ask a difficult question from retina, because I don't practice retina. I can ask some basic questions, but I cannot go into the details of retinal disorders. So you know your examiners, you know your internals, and so prepare accordingly. There are internals who have some favorite questions. They may ask you in OPD and round. Keep a note of that, right? Take your time. Don't no need to answer immediately. The moment question is over, don't jump on to answer. Take your time, think what is the question, and then respond to that. Never argue. At times, you know, there are examiner and also opthal, you know, you don't get everything in one book. So there may be three books. You have gone through one book. The examiner has seen something else in another book. So you say it's a rejection is 20%. He says ki no, no, 30%. Then don't argue with them ki no, no, 20%. मैंने तो यहाँ से पढ़ा था. Book जाके दिखा रहा है कोई. Don't do all this thing, because the examiner's ego will be hurt, and they nobody is going to buy that argument that he's wrong and the student is showing him the right data. So it's always a good habit, accept whatever the examiner is saying, because the examiner quite experienced, you know, they have gone through much more than what you have read in the textbook. So always listen to them, don't argue. keep your references specifically when you're quoting some figure. Suppose somebody asks you what is the graft rejection rate in herpetic keratitis. Okay. For that, you have to have a reference, you know. And one practical tip I'll give you, at least know the standard textbook's name. Okay. If somebody asks you what is the source of this graft rejection figure that you're quoting, don't tell them it's Kansky. So he will not buy that argument. If you say it's Krasmer, even if it's wrong, he will think, okay, this guy has at least read the Krasmer book, right? Don't give excuses. Read but forgot. This is what I told you even in between, है ना? A lot of students they told, sir मैंने कल पढ़ा था, भूल गया. So these excuses, no, the examiner, they were also at one point of time in their career, they were also resident. So they know that this guy doesn't know, that's why making excuses. Okay. And don't panic, just an exam, because at the first slide I showed you, I had to go through 3 days, different stages, different Viva, different cases, different format. So if one Viva goes wrong, don't go into a panic mode. If you go into a panic mode, that will start a positive feedback cycle. The second will become worse, and the third will become worse to worse. Okay. So if one Viva or one paper goes wrong, don't worry. You still have a lot of time or a lot of thing to catch up on that. Okay. So don't panic. That is the most important part. And move on to the next session. ठीक है, एक में जीरो मिल गया कोई फर्क नहीं पड़ता. Next you can score 80 90. Okay, that will compensate for that. Half of the time students fail because no, they panic. They fail to answer one common question, and then in that panic mode they keep on answering all questions in a wrong way. So that is what irritates, because in my exam, I'll tell you, one of my colleague, my examiner was insisting that this candidate should be failed. Why? Because in a panic, the examiner asked, how will you do refraction in a 2-year kid? And just like that, that guy answered ki I'll use tropicamide. As that was the only point. The examiner was like, no, no, if this student doesn't know this, he must be failed. So simple practical point, if you answer in a panic manner, you will answer wrongly, and then you will be examiner will be like, this guy know nothing. Okay. So don't go into panic mode. There is always a second chance. Always remember that. And these are the 3 books. Okay. The sole purpose of this book is to help you all guys. When I was appearing my MD exam, that was a horrible phase. Okay. So not because the examine or the examination or those were wrong, but the thing was that you don't have enough time. This practical is a big challenge because you don't have time to go through the books and read long case, short case. It's practically impossible to take out first your squint book, then take out retina book, and then take out your plastic book. It's better everything compiled in one particular book. So this is what is Ophthalmology Clinics and 212 does for you. And this book prepares you for theory, all the theory questions and how to answer that question, that is there. So if you read these 3 books, that will help you in scoring better in your exam. But these are not the only options. You can make notes. There may be other books available in market that can also help you in getting good score. I think here I'll stop. I hope this class will help you in scoring better in your exam.
Thank you, sir. That was a very insightful talk, and I'm sure a lot of postgraduates are going to benefit from it. We actually have a rather interesting set of questions from some very curious postgraduates. Um, I'm going to try and take those which you've not covered first. So there's a question which says, how can we use AI to prepare for the exam efficiently? I mean,
As I said, there are few questions like genetics in ophthalmology. है ना?
hmm,
For that, you cannot get concise information in one particular section, right? So you
hmm,
can this chart GPT, all this thing, they are basically AI based system only. You can just write in chart GPT, give me a summary of genetics in eye. Then it will
okay.
go to thousands of literature available on your Google, and it will give a brief summary, right? But remember, a lot of AI is basically artificial intelligence, right? So
Hmm,
whatever the data AI is using, that is already published somewhere. Okay.
hmm,
And it may not give you the exact picture of everything. So use AI for rapid revision or rapid collection of data if you haven't prepared for some disease. okay, or some particular topic you haven't covered, and that is difficult to cover from the textbook. Okay, so in those cases, use all this AI module that will help you. But at this stage, for exam preparation, AI has no role as far as I think. Yes, but this chat GPT or few of the new things that can help you in making good notes, but the data is unreliable, I'm telling you, because not only it will take data from PubMed, it will take data from Google also. And you know how
Mm-hmm.
Google data are either fake or written by people who are not expert enough. Okay, so you
Right.
may land up in trouble also. So don't use frequently, but when you don't have time, that's the only choice.
Mm-hmm. Okay. So can AI be used for note making to make notes on particular
You
topics?
have this advanced tools, nowadays, even if you are good enough, again I am coming back to the chat GPT part, because again that is probably the best AI model that we have. You can ask them, if you just ask, give me a chart of management of keratoconus, so it will give
Mm-hmm.
you a chart. But again, that chart he will not prepare on his own, right? He will pick up from either IG or some journal where somebody has given a chart, management approach to keratoconus. So you'll get it in short time, but again the authenticity will be little bit doubtful. That article from which it has picked, it may not exactly reflect, or the examiner may not like it, the chart that he has prepared. So let's
Okay.
good habit to prepare on your own.
Okay. So there's a question. How do examiners assess borderline cases? What tips the scale?
Borderline cases means about pass or fail or what?
Yeah, I think that's what
I
they
mean, you
mean.
need
What
50
tips
and you
the
are
scale?
scoring 48, right?
In case of an examiner is on the fence, they are on the edge, then what would be the important factor they would consider to decide?
But you're recording this PPT, right?
Yes, sir.
What I say, that will be on record.
Yes, sir.
And whoever asked that question asked to write to me. I'll talk to him. But
Okay.
Motamoti, I'll tell you, see, this is where I told you in the initial part. If your
Yeah.
theory is not that perfect, don't
Hmm.
bother. Do good
Hmm.
in practical. Most of
Hmm.
the time you will be passed. Okay.
Okay.
Because
Okay.
pass and fail will be decided by external and internal. Okay.
Hmm. 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 Hmm.
They are going to assess you in your practical. So if you
Hmm.
perform well, exceptional in your practical, even
Hmm.
I have seen people, they would go back and revise your theory score so that you can pass at least.
Okay.
So if you are
Okay.
a borderline case, theory you think that okay, I'm not done good enough, then please prepare well for practical.
Okay. Okay. That's a very encouraging tip, I believe. Okay. How do the next question is, from your experience, what differentiates a distinction level student from an average one?
Preparation and presentation. I'm telling you, IQ of all of us are same, right? And I'll
Okay.
tell you my personal example. All my book are based on my personal example of where I struggled. When I was
Okay.
up in a MBB, I was an MBBS student. There was a
Hmm.
question, okay, and I used to read a lot, but I never used to prepare how to
Hmm.
plan, how to present. There was a question of chronic otitis media, right? And
Hmm.
so I used to ask all my students कि एग्जाम में क्या करते हो, स्कोर इतना अच्छा क्या होता है. So I had a friend, of course a girl, and they are very good at presentation. So she had told me that I use different color pens to highlight the important parts, and unfortunately I started first writing headings in red pen, and my
Oh,
examiner specifically called me and scolded me, "Ki, how can you write a test, red pen?" So this is what I've highlighted in between. Plan your
okay.
presentation. Okay,
All
be
right.
specific that suppose there is some point that I want to highlight. I am
Hmm.
using a purple pen. If
Hmm.
there is a flow chart I am making, I'll use a pink pen. Okay, so
Okay.
use multiple color pen and highlighter. Even if you know five good facts, ensure that the examiner read that these 5 points are there in your answer sheet. So
All
that
right.
is a good score.
Okay.
All toppers are not persons with the best IQ. Remember that.
Okay. So there's a question which says, how important is it to memorize scientist names and years of discoveries, inventions for Vivas? I mean, how often is it asked?
These things, usually suppose in exam, what they normally assess is whether you know the basics. Okay.
Mm-hmm.
The basics, then they want to decide whether he will be the topper or she will be the topper. So
Okay.
you have cleared your exam based on theory
Mm.
and good performance in practical. But
Mm.
question is whether you are going to top the exam or not. That time these things do matter. Okay, the exam will try to guess. Okay, suppose there are some institute where gold medal is given, right? And
Mm.
for that, if you are aspiring for that, then you must know the history, the names, the spellings. These things will
Okay.
definitely be asked.
Okay.
To pass,
Um,
for me, just pass karo MD exam, For that, you don't need all these things. You just need the basics.
okay. This is a very important question. It says there are going to be some questions which we might not know. What are an examiner's thoughts on a student saying, "I'm sorry, sir, I don't know," or should we take a chance and say something which may or may not be right?
It all depends on your examiner. Okay, if the examiner is young, they would love if you are using your brain, because there is no question about which you know nothing in science. Okay, if not in MD, you must have read something in your MBBS. Okay, you must have heard.
Mm-hmm.
So if your
Mm-hmm.
examiner is young, encouraging, that you can easily guess from initial one or two question,
Right.
then you can guess, or you can say, "Ki, I
Mm-hmm.
think this may be right." Okay.
Mm-hmm.
But if your examiner is very old, very senior, don't bluff. Just simply say, "Ki, sir, I am not able to recollect at this point of time. So I'll not be able
Okay.
to answer this question." Okay. Don't say I
Okay.
don't know. Just say, "Ki, I am not able to recollect."
Okay. In interest of time, sir, I'll be taking this last question. Again, I think this is a question because of the evolving generations. They want to know how much importance is given to strict grooming in today's Vivas, or is it an obsolete concept, and how much you know matters more?
Could you repeat the question?
How much importance do examiners today give to strict grooming, like clean shaved face and strict grooming
With
over?
grooming. Okay, okay. I got it. So,
Yeah.
I'll tell you one of my experience. Okay. My examiner, when I went there, no, she didn't ask about the question or viva or the case. First,
Mm.
he had a complete scanning from my shoe to my head. Okay.
Okay.
The examiner are very strict,
Mm.
and examiner, they always want to check whether this guy is serious about the exam or not. Okay.
Okay.
So the first impression that you are taking exam seriously comes from your appearance. Okay. And
Okay.
you remember somebody is well dressed, okay, and cleanly shaved and appear in the and answering clearly. That
Mm.
will give the first impression that yes, this guy must be a sincere guy and must have prepared well. Somebody is going in Crocs, okay, wearing a t-shirt, even if he's a genius, the first impression will be he's not serious about the exam. Okay. So if you are well groomed, then you are not going to score more. But the first impression, in any exam, even if
Mm-hmm.
you are appearing IS exam, the first impression is very vital. Okay. Because I am telling you, in even as an examiner, I know that in 10 minutes I cannot guess somebody's skills, right? It's impossible.
Mm-hmm.
Okay. But all these things together, right? How clearly you have written your history, how well you are prepared, how well you are answered, may I come in, sir, can I sit, sir, all these manners, that starting point is good. If everything is perfect, then the examiner start with a positive note. Okay,
Okay.
so that is very important for exam.
So
But
for the
don't overdo it.
PGs, sorry,
Don't
sir.
overdo grooming part, don't overdo it. I have seen one candidate, with perfectly matched shoots, well shaped, so examiner may not like that also. Best is put on your lab coat and just go there with and don't go with sports shoe or slippers.
Okay. Okay. All right, sir. Thank you so much for easing a lot of our exam going postgraduates. For all our viewers, the next couple of months we are going to be focusing on eye in systemic diseases, which is curated by Dr. Parthapratham Datta Majumdar. The next session would be on 4th of June, Eye as a Window to the Body, an Eye Opener by the man himself, Dr. Parthapratham Datta Majumdar. We'll see you then, same place, same time. Have a great weekend. Bye bye.
Good night, everyone.